There's a big push for our state to do more to help drug-exposed newborns and their mothers. Our 4 Investigates team has extensively covered the comprehensive Addiction and Recovery Act, which serves to keep newborns with their biological families. Many believe our state law has not only fallen short of expectations, but has created a bigger gap for families and children to fall into. Today, state leaders address short and long-term fixes. Here's Brittany Costello.
It's a problem that folks on the front lines say is getting worse. The opioid crisis is not only destroying families, but having a devastating impact on children in our state.
Up to 20% of the kids are even are substance exposed. I've done this for 37 years, and this has never been the case.
That's a NICU nurse from Presbyterian advocating for change Friday at a roundtable focused on the state's comprehensive addiction and recovery program. It's a state law that passed in 2019. It eliminated the child abuse reporting requirement by the hospital. Instead, families are given a plan of care, but the goal of getting families necessary help has fallen short.
I have seen more times that we have called and called and called that we know a family isn't safe, we know this isn't okay, and I can count on my 2 hands the number of times we've seen that baby come back to us shaken.
State leaders from CYFD, the Department of Health, Human Services, and beyond say they are working on a solution, a plan to ensure families and babies are getting the support they need.
But there has not actually been a program developed in the state of New Mexico to deal with the issue.
CYFD Secretary Casado says the CARA program will move under a new Family Services division, where they plan to budget for 35 employees. In the meantime, Human Services is making immediate changes in how they serve these families.
We are going to be requiring initiation of in-person care coordination at hospitals, the biggest hospitals in New Mexico where the most babies are born.
Secretary Carrie Armijo says those care coordinators will make daily rounds and speed up the timeframes to get families the necessary assessments.
Sometimes, we do lose contact with the mom or the guardian of the baby when they leave the hospital. So we're really going to put boots on the ground to make sure that we can get out there and reach those members.
Brittany Costello, KOB4.